Are you looking for a health screen that actually provides enough detailed information so that you can make an informed decision on how you can improve your health and decrease your disease risk? One that's provided by a clinician who thinks outside the box, has over 31 years of clinical experience, and practices an integrated approach to medicine. If the answer is yes, please continue to listen. My name is Jerry Gajada Singh, and I founded The Health Equation based in London's Medical District back in 2004. I see many patients who have previously had executive health screens, normally from large providers, who offer a series of tests followed by template reports that usually informs the patient that they are fine and they will see them next year. The patient, of course, then carries on doing what they've done before, oblivious to the things that might be starting to go wrong with their health. Because of how they're interpreted, health screens often only pick up things when a disease process has actually started. This has been the accepted way of doing things for many years and is currently the model used by most clinicians and accepted by their patients. To be fair, it's the way most people think about health and illness. They assume that because they feel fine, they must be. They wait for symptoms to start before they seek advice. People seeking health screens tend to be more proactive themselves, or they may be lucky enough to have a health screen offered as part of their work benefits package. Therefore, I'm sure those sorts of people would be interested to know that you can now have a health screen that helps you understand how your body and mind are working together and what can be done to improve them. My main job at The Health Equation is the diagnosis of complex health problems, with the majority of my patients referred by GPs and medical consultants for second opinions to help them work out what is wrong with their patients. I then develop an appropriate treatment strategy, which may include conventional medicine, normally drugs or surgery, but most often functional medical approaches. So what is the difference between conventional medicine and what we call functional medicine? The main paradigm of conventional medicine is to discover if the patient has an active disease process, what it is, the diagnosis, and then suggest appropriate medical intervention or treatment. The problem for many patients who develop symptoms and their clinicians, the patients are often found to have no active disease process. Research suggests that up to 40% of patients presenting to the GPs, this is actually the case. And yet there must be a cause of their symptoms. The majority of these patients will be found to have functional problems, something that is not working properly. The three main areas of functional disturbance are, number one, structure, which essentially is neuromusculoskeletal and visceral function, the viscera of the internal organs. Number two, biochemical. This is mostly to do with hormones, nutrition, and breathing. And number three, psychology, and this includes conscious and subconscious patterns or behavior. The history of the patient will often reveal whether these factors are contributing towards how the patient's body and mind are working. Then comes an appropriate clinical examination of different body systems, similar to standard health screens, but with greater emphasis on palpation. Palpation means feeling structure, one of the unique skills of an osteopath. So what happens during an individual health screen? The individual health screen will last about 75 minutes. I will ask you lots of questions, what we call the case history, as well as appropriate testing and interpretation of results. A key part of the health screen should be the case history, really listening to the patient's story and concerns, their past medical and family history, and an in-depth exploration of lifestyle, both the good and the bad bits, which research now confirms has a major impact on our health and development of symptoms and eventually disease. For the individual health screen offered at The Health Equation, we run a range of diagnostic tests. These include capnography and heart rate monitoring. You may not have heard of this, but this specialized piece of equipment non-invasively measures levels of something called end-tidal CO2. Why CO2? Because paradoxically, CO2 is just as important in the chemistry of breathing as oxygen. Breathing rate, heart rate, and heart rate variability. This cutting-edge piece of technology gives the clinician and the patient, once it's explained, great insight into not only respiratory behavior and function, which influences many chemical reactions in the body and mind, including cellular oxygenation, control of pH, but also evaluation of something called the autonomic nervous system, which controls all of our body systems. We also fit you with a Holter 24-hour ECG device. This clever bit of kit records a 24-hour ECG analysis to check the function of the heart and its rhythm. We organise a comprehensive blood analysis, including hematology, biochemistry, inflammatory markers such as ESR and CRP, lipid profile, blood glucose, and thyroid function. We also offer a simple urine analysis, a simple dipstick test to give us an insight into urinary function. We then give you a little kit called a fecal occult blood testing kit, offered if you're over age 45, to pick up blood in a stool sample as part of the screening for colon cancer. Your blood tests are then run through special software that compares your results against both standard medical reference ranges and what we call functional reference ranges, which can give us extremely useful information to advise you on improvements for your health. Medical reference ranges, when used in interpreting blood tests, are based on a statistical term called the normal distribution, where 95% of the results are in the range. What this actually means in practice, that the vast majority of patients are told that their blood tests are normal. Whilst that is probably correct from a pathological or disease perspective, it gives no insight into the functional changes that may be relevant to the patient. Therefore, at the Health Equation, we use different, narrower reference ranges based on more recent research. It can help us manage patients differently, again giving more targeted treatment interventions. The comprehensive post-consultation report includes a functional blood analysis, an out-of-optimal range assessment, a functional body systems report, which gives an indication of the level of dysfunction that exists in various physiological systems of the body, and your micronutrient status. We also offer some additional tests, for example, such as for men, a prostate profile, where we measure total PSA, which is prostate-specific antigen, and free PSA from the blood sample, and this is generally offered from age 50 or above, or sometimes earlier if requested. The NHS currently offers regular screening for women regarding mammogram and cervical smear testing. Therefore, we do not routinely offer these additional tests to women, but of course they can be arranged if requested. Additional specialist investigations can also be arranged if clinically indicated, such as X-rays, other imaging such as MRI, coronary calcium scan, carotid ultrasound, etc. If indicated, they can be arranged at one of our local hospitals or clinics. The individual health screen also includes a cardiovascular risk assessment, smoking lung cancer risk assessment, and a fracture risk assessment. After the health screen, when I've received all the results of the investigations, I will write a bespoke and comprehensive written report, which is usually at least 35 pages long. This will include all your results, any suggested follow-up investigations or opinions from medical specialists, and of course lots of advice to help you be more proactive about your health. The patient may also request a 15-minute follow-up consultation, either in person or by Skype, FaceTime or phone, if they need clarification on certain aspects of their report or for follow-up advice. We also offer an integrated health screen. This includes all the elements of the previously described individual health screen, but in addition, more functional tests, which look at additional nutritional and stress markers, and an exercise assessment is also included. Thanks for listening. This has been Jerry Gajada Singh at The Health Equation.